So the anatomy of the oral cavity, for the most part, can be seen almost exclusively from this view on the hemihead, this mid-sagittal cut from the hemihead. So as you eat food, what's the first thing that the food passes in order to get into the mouth? Your lips. So the lips are an essential part of your digestive system. They're called your labia. Labia is just Latin for lips. This space between your gingiva and your teeth and the labia, this space right here is called the vestibule. There's a superior vestibule and an inferior vestibule. That food is then going to pass into the open cavity. The open cavity is going to be the oral cavity. Okay, that oral cavity has your tongue inside of it. If you lift up your tongue and feel, what you're going to feel is a flap of skin underneath your tongue. That's called the labial frenulum. So this, I said labial. No, this is the lingual frenulum right down here. The lingual frenulum, you also have labial frenulum. Okay, that's if you pull your lip out, you can feel that little flap of skin right there in the mid-sagittal portion. That's also a frenulum as well. On the superior aspect of the oral cavity, we have the hard palate, which is going to be defined by both the maxilla up above and the palatine bone up above. And then we have all of this soft tissue back here, which is going to be the soft palate. At the very base of the soft palate, we have the uvula. That dangly thing at the back of the throat, that's the uvula. And this passageway, right here that you see, the opening, that passageway is called the fauces, or fauces. Okay, that's the open passageway that is going to extend from the oral cavity into the throat. Of course, we don't call it the throat, we call it the pharynx. And the pharynx was divided into three portions: the nasopharynx, the oropharynx, which is the region of the throat that's shared at the back of the oral cavity, the laryngopharynx, which is the region that is shared with the larynx. If you swallow, the tongue depresses, and it's going to move this piece of cartilage called the epiglottis down over the opening to the larynx. Larynx opening is called the glottis. So the epiglottis covers the glottis, and therefore food is going to move down this passageway here into the esophagus, which is this muscular tube in the back. There's only one more thing to know in here, is there is a sphincter. Okay, there is a muscular sphincter that can constrict and relax. Most of the time it's constricted, which keeps things from getting down into the esophagus when you don't want to. But when you swallow, part of the swallowing reflex is to relax the upper esophageal sphincter, and that allows food to descend into the esophagus, and then the esophagus starts doing peristaltic waves and sends that food down towards the stomach. Alright, that's the end of this video. We'll see you in the next one.